So surgery these days is a lot of times overused. It's put into a place where, folks come to expect it, or the doctor's told them, listen, the only other option for treatment is surgery. And we get to this point because when patients come in and they've got knee pain, we follow a step-by-step process. And in that step-by-step process, the standard care in our medical system right now is usually the first step is physical therapy. Okay, patients go through 6 weeks of physical therapy, and usually they don't see much improvement, or a lot of times they'll get worse. Because if there's actual tissue damage in the knee, you're stressing, you're working on that joint, it's going to cause a lot more inflammation, a lot more pain. So if the physical therapy fails, the next step is medication. Okay, so patients all of a sudden are treating the pain with medication that's easing the pain temporarily, but the pain keeps coming back. Why? Because we're not fixing the problem. And then it gets to the second level of pain management, injections. Start doing cortisone. Okay, temporary relief. It's helping with the inflammation, it's helping with the swelling and the pain, but the problem still persists. The knee starts wearing down even more. Next step is hyaluronic acid. We put a lubricant in the knee. We decrease the friction, we decrease the inflammation. You do a set of these and it lasts for 3 months. But then it wears off because the change is still in the knee, the problem's still in the knee. And that tends to lead to the final step of surgery. Now, we step in that gap. When there's pain, we know there's dysfunction. There's dysfunction usually due to tissue damage. So we assess the tissue damage and we understand, can we help this tissue repair? Repair without surgery. With stem cell therapy, we can transplant these cells from your body into the damaged components of the knee and stimulate that tissue to repair. So what does this do? It regenerates cartilage, it regenerates meniscus tissue, builds back the natural support tissue. What does that do in the long term? It decreases the inflammation, decreases the pain, increases your function. You're repairing the damage. So we don't need that final step of knee replacement surgery. You're actually accommodating the knee, you're getting that knee healthy much before you ever have to step into knee replacement surgery. We've helped many cases that are bone on bone actually recover enough that they can live a normal, happy life. So surgery is your final end stage, first to last option. We got to get there and heal the tissue first.